welcome. Thanks for carving out time that we know is precious for this training. Um, and welcome to this edition of Safety Included, which is a workplace health and safety training series brought to you by Encompass Michigan, the statewide network of comprehensive human service providers working together to develop independence and achieve inclusive communities. Our topic today within the Safety Included framework is blood-borne pathogens. My name is Todd Culver. I'll be presenting to you this afternoon, as will my colleague Katie Kindy, and we'll both introduce ourselves a little bit more in a moment. It's important that you know that this material was prepared under a consultation, education, and training, or SET grant. Those are awarded by the Michigan Occupational Safety and Health Administration, or MIOSHA, which is a part of the Department of Labor and Economic Opportunity, or LEO. So a little bit more about my background. As you may know, I'm the president and CEO here at Encompass Michigan. That means my overall job responsibilities include leadership and program development, strategic planning, financial planning, and always in alignment with the purpose, vision, and values of the association. I've been with Encompass since 1995. Started service here as a project director and moved up to assistant director, and I've been in this role for about 11 years now. As project director, which is where I started, I actually led the technical assistance and training project that was funded through a SET grant that focused on occupational safety and health for our member organizations. And spent about 15 years in the field, becoming very familiar with the work that our members do, as well as the content of the training. And part of that content experience comes from a prior working life where before I came to Encompass Michigan, I worked in the manufacturing sector for a tier one automotive supplier, and my responsibilities there for about 8 years included plant management and environmental health and safety compliance. Returning to more direct involvement of this project, I'm delighted about that and looking forward to it. And I'm going to turn it over to my co-presenter today to introduce herself.
Thank you so much, Todd. I am a 35-year-old autistic self-advocate who loves learning and helping others learn. I graduated in education with a focus in learning design and technology in 2021 from Wayne State, earning my master's degree. I currently work for Encompass Michigan as the education coordinator. If you've been to any of our events, I'm probably the one running around making sure everyone is getting their certificates, either social work or CEU education. I have completed multiple leadership programs in 2023 to 2024, and I've presented multiple times about autism in the workplace. I became a co-leader in 2024 for the Michigan Advocates to End Seclusion and Restraint, but I am now on the NSAR board. In my spare time, I love to garden. I do various crafts, but I mostly love to hang out with my husband, playing video games and walking my dog Agro.
Thanks, Katie. Katie's terrific. We're very fortunate to have her as a member of the Encompass Michigan team. With regard to our content today, we're going to talk about a topic that's very specific to a MIOSHA standard, but we're also going to place that within the context of the focus of this project, which is inclusion and inclusivity, which is a priority, a core value, and very important to us at Encompass Michigan. This presentation was made with all needs in mind. We try to avoid using too many visuals such as colors or pictures, and when we do, we try to describe them for any low vision users. And we'll also have handouts that are available in a shared drive, and a link will be posted to those handouts in the chat later.
I also sent out that link via email to anybody who registered.
Excellent. Thanks, Katie. So you will have access to some of the resources that we'll be talking about relative to bringing training into a more inclusive level. So as workplaces evolve, one of the emerging trends in Michigan and throughout with employers throughout the country is the need for safety programs that support workers with different learning needs and different communication styles. So, as part of this growing need, Encompass Michigan in this year, through this program that's funded through the MyOSHA SET grant, will deliver neurodiversity conscious training that's designed um, to be geared towards workers with intellectual and developmental disabilities, autism, and other neurodivergent conditions. The overarching framework of safety included follows some guidance that was actually issued through federal OSHA, some recommended practices for health and safety programs that present a real step-by-step approach to implementing those programs, and it's built around some core elements that make up a success. The main goal of safety and health programs is to prevent workplace injuries and illnesses, and that'll be our focus today as we discuss bloodborne pathogens. We'll certainly bring forward a lot of information to you, but we'll focus on that preventive part because injury and illness can cause suffering, financial hardship, both for the workers on the job as well as families and employers. The recommended practices that we'll promote and aspire to follow use a real proactive approach to managing workplace safety and health. Now, traditional approaches can be reactive. In other words, problems are addressed only after a worker's injured or becomes sick, and a new standard or regulation is published, or even an outside inspection occurs and a problem is found that has to be fixed. But these recommended practices, and this will be consistent with all our topics with safety included, will recognize that finding and fixing hazards before they cause injury or illness, we'll focus on illness today, is a more effective approach. And it's sort of our thematic underpinning behind these trainings is that the most rigorous preventive program takes the view that there's always, and that's capitalized for a reason, always something about an incident leading to injury or illness that could have been different. In other words, accidents don't just happen, and it's incumbent upon us. It's our responsibility to continuously assess the landscape that we operate in, that we serve people in, and that we employ people in, to identify the potential for a problem and fix it before it occurs. So that's what this presentation is all about, with a framework for effective safety programs that promote prevention, and we'll filter that down specifically through the lens of bloodborne pathogens. It's our goal through the project to provide clear and structured visuals as well as graphics that will support comprehension, especially for neurodiverse trainees. We'll attempt to minimize sensory distractions, and this is what we'll encourage if you all are delivering training to the folks in your teams or individuals that you serve or support. Minimize those distractions in both virtual and in-person settings. Talk about options for both verbal and nonverbal participation. Katie will get into that in a few minutes. There should be interactive components that promote engagement without overwhelming, and the benefits of time buffered schedules to allow for processing and reflection will also be discussed. And what this all means in our view is that a safe workplace is good business, it's sound business, and that's for everybody, irrespective of neurotype. So to focus in then on bloodborne pathogens, what the portion of the training that I'll be presenting today is specific to the MyOSHA standard on this topic. It will outline the employer responsibilities and requirements under that standard. There are some definitions that will be provided that are key terms that are used in the standard, as well as the diseases that bloodborne pathogens can cause, some of the situations that can put employees at risk specific to job tasks and categories, and most importantly, and again, this is the preventive part, how to protect yourself.
And then, oh, sorry.
Go ahead, Katie. Go ahead.
I was going to say during my portion, I'll be talking about employee training considerations for employers, mainly building trust with employees, what to do during emergencies, preventing sensory overload, and being mindful of sensitivities, verbal versus nonverbal communication, clear signs, clear signs meaning signage around the building, proprioception, time buffered schedules of memory capacity, training locations, and then we'll end everything off with a resource that we created, and we will show an example of what it looks like to use the resource that we created.
Great. Thank you. So the MIOSHA standard that I've referenced is part of the general industry standards for MIOSHA. It's part 554, and its actual name is blood-borne infectious diseases. And one of the principal requirements under the standard is that employers conduct what's referred to as an exposure determination. What that means is that if we're creating work for someone else or serving people in an environment, then as employers or as service providers, we need to evaluate the tasks that we're asking people to perform and evaluate whether or not they're whether as part of their regular routine or something that might come up and could be reasonably anticipated, if there's the potential for that employee's exposure to blood or what's referred to as other potentially infectious material. And I'll define that more clearly in a moment. It's also required under this exposure determination process to maintain a list of those job categories where there may be an exposure. Training is also required under the rule. It's required for all who face exposure as a part of their job duties. It should be available at no cost and during working hours. And it's one of the MIOSHA training requirements that includes an annual refresher. So this training should be delivered at the time of the initial assignment that puts an individual at risk and then repeated annually thereafter. And from our perspective, it's very important that training on any topic be delivered at appropriate levels that really promotes employee understanding and therefore results in their safety. Some of the definitions that are key to the standard include bloodborne pathogens themselves. These are pathogenic microorganisms that are present in human blood. Speaking plainly, it's something that can make you sick. And the diseases that these bloodborne pathogens can cause include hepatitis B, HIV, which is the acronym for the human immunodeficiency virus, the virus that causes AIDS, as well as hepatitis C. So potentially some very serious illnesses the germs that cause them can be present in human blood. Contaminated is a term that means that blood is present, or we can, again, reasonably anticipate that it might be present. And that's true of blood or other potentially infectious materials. And to define that term a little bit further, you may see it occasionally referred to by its acronym, OPIM. These materials include the body fluids that are associated with sexual activity, some of the fluids that are associated with certain medical procedures, and also saliva in dental procedures. And it's important to reference the dental procedures. What's not included, some of the body fluids that we may encounter, especially if we're involved in direct personal care of others, include vomit, urine, feces, full of all kinds of germs and bacteria that can cause illness, make no mistake. But in terms of being capable of causing these two strains of hepatitis or HIV only if blood is visibly present, the same is true of sweat and tears, as well as saliva, again, unless blood is visibly present, which can often happen in a procedure such as in the dental chair. So the situations that can put us at risk, I break these into three categories for our types of working environment, like manufacturing, contracting, or direct care and support. The first of these risky situations is contact with what's referred to as non-intact skin. And the most practical example of that is for a person who's providing first aid to another individual who may have experienced a cut where blood is present. If they do so without donning the appropriate protective equipment, which I'll cover in a moment, and that individual who's providing the first aid on their hands has a cut or a sore or a scratch, then that blood has made contact with skin that's not intact, therefore not capable of providing a barrier or a protective barrier, and therefore that puts that person at risk. The first aid provider would be at risk. The second area is through contact with what are called mucous membranes, which is a term that describes the eyes, nose, and mouth. If we are either responding to an incident where a lot of blood is present, or treating an injury that may be serious, that can occur through a blood splash, but it's more likely to occur through secondary contact. And it's important to remember this when we're training others on these procedures as well, that accidental secondary contact can occur even if an individual has taken the proactive steps of wearing protective equipment. For example, if I've treated an injury and I've worn my gloves, but before I'm finished, before gloves are removed, if I forget what I'm doing and accidentally or unintentionally make contact with my eyes, if you can see my image on the screen, I'm making contact with eyes, nose, or even mouth, then I've put myself at risk. So either primary or secondary contact can be a risky situation in these instances. And the third is a wound from a contaminated sharp object. For those working in a medical environment, a used needle is the primary risky situation. For those of us who may not be in that type of environment, it's probably more likely to occur through broken glass or any other kind of sharp object that caused a cut and then has blood on it. So these are the three areas that we think present some risky situations in terms of workplace encounters. There is an appendix to the MIOSHA standard. It's Appendix A that lists the occupations with potential for exposure. It includes some of the types of jobs that you would expect, such as healthcare personnel, doctors and nurses, dentists and dental care workers. But it's also important to acknowledge that it includes housekeepers, janitors, and maintenance workers, folks who are doing tasks in the type of working environments and care environments that we find ourselves in that can also put someone at risk. The signs and symptoms of the diseases that bloodborne pathogens can cause, starting with hepatitis B, symptoms of HBV are mild usually and flu-like. They can include fatigue, stomach pain, loss of appetite, and nausea. Further progression can lead to a yellowing of the eyes or skin that's referred to as jaundice, and even a darkening of the urine. However, it's also important to acknowledge that some individuals infected with HBV will show no symptoms for quite some time. With hepatitis C, it can be symptomatic and result in mild illness. If symptoms do occur, 1 out of 5 may experience that yellowing of eyes or skin referred to as jaundice or other flu-like symptoms. After acute infection, up to 1/4 of persons appear to resolve their infection without treatment. However, regardless of how the infection is resolved, the experience does not provide immunity to reinfection. And so chronic hepatitis C infection develops in the remaining approximately 75% of persons infected, with chronic liver disease developing in a high percentage of cases as well. Extreme fatigue is a very common symptom in persons with chronic hepatitis C. So we outline these symptoms not to raise any alarm, but just to remind folks that the potential for these conditions, if exposed, to advance to really serious levels is there. So it's important to acknowledge that. And with the third pathogen, the human immunodeficiency virus, or HIV, this can also be asymptomatic. It can result in mild illnesses. Again, people may not have any symptoms when first infected, but within a month or two after exposure to the virus, quite often flu-like symptoms will emerge, and these include fever, headache, fatigue, and sometimes enlarged lymph nodes. In addition, some other symptoms that can be experienced, and this is after more time lapses, is a significant lack of energy, extreme weight loss, frequent fevers and sweats, especially night sweats, and skin conditions that can resemble a rash or even very flaky skin. The good news, having just discussed some the symptoms of illnesses that can be very, very serious, the good news on the hepatitis B front, at least, is that there is preventive medicine that's available. And with the Hep B vaccine, what has resulted is the number of new infections declining dramatically in recent years, and that's primarily due to routine vaccination. The shots are administered in a series. They can either be 3 shots administered over the course of 6 months, which is the most common delivery. There are different brands available now, so there is a 2-shot option for another brand that means that the shots will be delivered about 1 month apart. The Centers for Disease Control and Prevention, and the CDC, which remains the go-to source for health information, recommends vaccination for everyone under 18 years old and any adult who is at risk. Now, we need to acknowledge, and you may have noticed in the media lately, that a federal advisory panel did vote to change the longstanding universal Hep B vaccination guidelines, meaning rescinding the recommendation just from that panel to administer the vaccine series beginning at birth. But it's equally important to acknowledge that the official CDC guidelines have not changed at this point. Relative to the rule and the hepatitis B vaccine, the MIOSHA requirement is that within 10 working days of the time of initial assignment, an employer shall make the Hep B vaccination available to each employee who's at risk of exposure as part of their primary job duties. It's also important to note that employees certainly don't have to accept that offer. If they initially decline, however, and later change their mind and decide to accept, the employer shall provide the vaccine at that time. And there's also an option for first aid responders. So administration of the vaccine or offering the vaccine may be postponed if the primary job assignment is not rendering first aid. In other words, it's only what's referred to as collateral duty. However, it does need to be offered within 24 hours in an event where responders render first aid in any situation involving the presence of blood or potentially infectious materials. And now we get to the proactive and preventive part. The key concept here is referred to as universal precautions. Some folks, in fact, refer to this training as universal precautions because it's that important to the whole topic. What it means in plain language for us is be careful all the time. It involves an assumption that all human blood and all body fluids are infectious. It means that whether we're treating an injury or conducting a cleanup, we use those universal precautions before we get involved, and that we take the necessary steps, and I'll go through these in a moment, to make sure that the stuff that could make us sick, the potentially infectious material, doesn't get in you, doesn't get inside your system, and doesn't get on you, doesn't get on your skin, particularly non-intact skin. And if we take those steps, we'll go a long way towards remaining safe and healthy. Biggest part of that is the use of personal protective equipment. This usually involves the use of disposable or single-use gloves, and these can be made of a variety of materials, including rubber such as latex or nitrile, or vinyl or plastic-like gloves. Latex, nitrile, and vinyl are all equally protective. If employees are trained and authorized to administer CPR, then a mask should be available to them for rescue breathing procedures. And while not necessarily required in every single injury treatment or cleanup operation, it's important to have available eye protection, surgical masks, gowns, and other protective clothing, just in the event that there is a serious accident that needs to be responded to. Once we've completed the task, whether it be first aid treatment or cleanup involving the presence of blood, gloves need to be removed and removed safely. And if we're not careful with this process, and this is important to carry on to others when we're providing this training to colleagues, team members, or persons served, is the first thing to do with two gloved hands is to grasp the outside of the opposite glove, pinch it a little bit so you can pull it out away from your skin and then pull it back and remove it. Once that glove is pulled off and turned inside out, it can be captured inside the gloved hand. So it's kind of balled up and placed inside the gloved hand. And then now with that hand where the glove has been removed, holding the glove that has been removed in the gloved hand, we slide that one finger or possibly two underneath the gloved hand that remains, and then peel that second glove back over the first glove. That creates a nice, neat package where only the inside of the glove is touched by the responder or the cleanup person, and then it can be safely disposed of. Thanks, Kenny. After it's removed, hand washing is important. First, we need to properly dispose of these single-use latex gloves to turn them inside out and placed in designated containers. If no blood has been present, they can simply go in the trash. If there's a lot of blood present, it needs to go into a designated container, which I'll review in a moment. Clothing that's been contaminated should be washed and washed separately. And very importantly, hands should always be washed in any exposed skin, preferably with soap and water. Waterless disinfectants and alcohol wipes are acknowledged as effective germ killers as well, but a sink with soap and water is still the most effective method. For cleanup, we want to wear that PPE. The right solution is important. It should be a mix of bleach and water in a ratio of 1 part bleach to 10 parts water, or an EPA registered disinfectant. If it's a standard disinfectant and it does not have on the label that it's EPA registered for this purpose, then it may not be appropriate for use in a cleanup. So it's important to examine the label. And if we're ever involved in a cleanup that involves sharp objects, we should use tools for that, tongs, or perhaps a brush and a dustpan to pick up broken glass, never using our hands, not even gloved hands. If as a result of cleanup, there's a significant amount of blood present in the materials that have been used to absorb that blood, if it's liquid or has become semi-liquid, then that, along with any contaminated items, should be disposed of by placing in a closable biohazard or red-colored container. There's an image of a container on the screen that's bright red. It contains a biohazard label on it, and also depicted on the screen is the symbol that's used to signify a biohazard in addition to the English word. And lastly, a big requirement for employers under the standard is an exposure control plan. This is a written document that outlines that exposure determination that I defined earlier. That is a list of who's at risk. The organization's hepatitis B vaccine policy will be stated there, options for employees and employers depending on the employee's job category. Control methods should be listed out, and these include universal precautions, personal protective equipment, hand washing, and waste disposal. And when I covered waste disposal, I did not mention needles are not frequently used in our work environment, but if they are encountered, found, or medication is being administered by a needle, it needs to go in a separate designated biohazard container that's specifically for that purpose. If there is an exposure at work, there's an evaluation process that will be defined in this document that includes reporting requirements, the availability of immediate treatment, and some ongoing follow-up. The training requirements will be spelled out there that, again, involve both an initial training and annual refreshers. And then the record-keeping requirements are also listed in this document. There are 3 types involved. One is for medical records in the event that employees are ever exposed, records on the training, who received it and when, and a separate log for any incidents that involve sharps or needles. I'll turn it over to you, Katie, for the balance.
Thanks, Todd. And this section is how to train effectively, especially on the subject that we just went over. And thank you, Todd, for your expertise on blood-borne pathogens. Here at Encompass, Michigan, we believe that each person, regardless of neurotype, has a preferred learning method, and the following is meant to help employers improve the training methods for better outcomes. So, considerations for neurodiverse employees. Employees of different neurotypes may have different needs to consider. Talking to employees directly about their preferences is the best way to ensure learners' needs are met. So, gain trust by asking for consent to ask these questions to neurodiverse employees and ask them for ways to improve trainings to help them. Create a trusting relationship so that in times of stress, like injury or spillage of bodily fluid, employees can go to employers without fear. Neurodiverse employees can have anxiety, so be patient. Always speak concise and in a neutral tone. Some employees may need additional support and freedom to ask questions to better understand. It is important to forge this trust early on. Treat questions with respect so that employees do not fear being ridiculed in the future. So this is an example if an employer is conducting a training on gloves. The neurotypical or the neurodiverse employee might ask, "What types of gloves are these?" And the manager would say, these are medical grade gloves and they can be used for first aid and cleanup. The neurodiverse employee may say, "Well, I mean, are they latex free?" The manager reads the box. Basic SynGuard nitrile examination gloves which are powder free, medical grade, and latex free. The employee asks, "Why do we get blue gloves?" The employer says, "I'm not sure. It's just the ones that we order." The employee asks, what size do we have? And the manager says, we have small, medium, and large. The employee and the employee asks, can we get other colors? The manager says, I'm not sure. I may have to get back with you on that. The employee asks, can I bring in my own gloves? And the manager says, it's company policy to use the gloves provided, which will help keep you safe. They are designed to be appropriate for the job we must do. The employee asks, what if the glove box is empty? The manager says, you can talk to Stacy. She has the key to the supply closet and can get more gloves. The employee asks, what if Stacy is not here that day or busy? The manager can say, let me know. I can also unlock that closet too, but it's Stacy's job to do it. And then the employee finally asks, in my last job, someone stole all my gloves. What if someone takes the box of gloves? The manager says, that is highly unlikely here, but if you suspect this is happening, please let me know right away. And this is just an example of something that may seem like too many questions on the outside, but it's a way for somebody who is neurodiverse to better understand the gloves and also help them retain information. So it's not something that is malicious. It's not something that they're trying to waste time. That's just how they learn best. I also wanted to talk about universal design because it allows educators and learners to set goals, anticipate environmental barriers, create meaningful options, and fully embrace human variability. Having multiple methods to learn safety ensures that everyone has the resources they need to learn processes regardless of neurotype. Consider making step-by-step documents, signs, videos, and plan on showing processes in person. This way, everyone can have multiple options to learn the same information. For neurodivergent employees, handling workplace emergencies involves a combination of pre-established strategies and on-the-spot adaptations, such as developing clear written emergency plans, minimizing sensory overload, and creating a support system with clear communication channels. Consider creating a personal emergency checklist between the employee and manager. Another tip, there should be easy to access information for employees to contact supervisors during an emergency. That means multiple forms of the same information accessible to everyone. Consider giving a direct phone number for the employee to put in their cell phone, a business card sized reminder for their wallet that says, in case of emergencies, call blank, a card that can fit in the employee's name badge or lanyard with contact information, a sign or what to do binder in the workspace where hazards are that shows the information on how to contact someone in an emergency. If the employee has a co-worker, consider have them be an emergency buddy in case your neurodivergent employee may go nonverbal. What is an emergency buddy? This is a term I came up with, but essentially, it may be you can call it something else, but the main goal is to ensure there's a trustworthy coworker for a neurodivergent employee in times of an emergency who can guide them during moments they are overwhelmed. Sensory overload. That's something I mentioned before. It's a state where the brain receives too much sensory input and it leads to symptoms like anxiety, irritability, confusion, and physical discomfort. It can be triggered by common stimuli such as loud noises, bright lights, strong smells, and crowded spaces, but also by emotional stress, physical fatigue, or environmental changes. During sensory overload, information is less likely to be retained, and this leads to an unsuccessful training. Recognizing triggers and using strategies like reducing exposure to stimuli and using sensory aids or finding quiet spaces can help manage it. Consider ways to ensure neurodiverse people are comfortable within the training to ensure information is more easily retained. Sensitivities, especially when it comes to employees with autism, may be extra sensitive to loud noise or bright lights. Consider their needs. Converse and ask if any changes to the environment could help their learning experience and prevent sensory overload. Some items that can be offered: white noise machines, access to white noise music, which can be free in many places, including YouTube, tinted glasses, and headphones. Um, and so, also for auditory and visual considerations, ensure that your trainings are accessible. Neurodiverse people are prone to comorbidities. Visually, you should have large text and describe images for anyone with low vision. When speaking, ensure that you are using a microphone if there's anyone with low hearing. Consider sensitivities to scents. For those who are sensitive to scents, cleaning materials may be overwhelming. There are ways to manage these scents personally and environmentally. These are just some examples. A employee can personally mask the smells by dabbing a scent like Vicks Vapor Rub, lavender, and peppermint oil underneath the nose or inside a mask. Um, Breathing through the mouth or taking shallow breaths, or even humming may be able to block a smell. Scented items like minty gum, strong mints, or Listerine can also help. Essential oils, using a badge reel with a felt pad soaked in lemon or peppermint oil for personal scent relief. Hygiene, wearing clean uniforms and socks daily to avoid carrying odors, or taking quick breaks for some fresh air. Also, environmentally, cleanliness is key. Removing soiled linens and clean surfaces is the best way to get rid of most odors, but plain coffee grounds, charcoal, or baking soda can also be placed around the room in bowls and it can absorb odors. There's also different types of cleaners, but I wouldn't recommend those in case there's certain requirements medically for biohazards. That would probably just be something to consider, like maybe in the office setting. Ventilation and ensure proper air circulation is in using fans or opening windows when possible. And then there's tactile sensitivities. For those who are sensitive to the feel of latex, soft, thin silk or cotton gloves can be used underneath normal gloves. For those who do not like the feeling of normal masks, materials matter. You can choose soft, breathable fabrics like cotton or liners underneath other masks if the materials of a um, normal mask do not feel good on your skin. You can reduce the pressure by using ear savers that can be placed on the string of a mask or hats to place straps over. You can also look for masks that have toggles or Velcros to customize and reduce the tightness. PPE, just like with the last slide, employees of all neurotypes may have these issues with tactile sensations. However, neurodiverse people are more prone to other issues such as skin latex allergies. So always have accessible hypoallergenic gloves if you have latex ones around. Also, moving on from sensitivities, this is about proximity. So consider proximity comfort slash consent. This should be discussed from everyday interactions beyond trainings. Even something as simple as placing a hand on a neurodivergent employee's shoulder may be extremely uncomfortable. So always ask for consent. For example, during an interactive in-person training on a glove disposal, a trainer may need to hold their hand up close to a neurodivergent employee to show each step of glove removal. Trainers should ask if it's all right to be up close before showing each step. Also, let the employee learn by removing their own pair of gloves. Consider some employees may prefer verbal or nonverbal communication. And nonverbal isn't just about not talking, it's about using diverse communication methods, gestures, and visuals beyond speech because they face sensory challenges and process language differently. Um, Also, sometimes certain neurotypes, especially people with autism, may need to go nonverbal due to severe overwhelm. So, when this happens, it requires patience and clear, direct communication, respecting their cues and understanding their unique sensory processing needs to bridge gaps. But what is the best method is communication before a shutdown. That's essential for preparing for these moments. Though not required, some employees may even prefer having signs on their door or on their name badge that show their current availability verbally. I have a picture here on the right of three signs. There's a green sign that says come in, a yellow one that says important only, and a red one that says do not disturb. So these three signs can show the availability of somebody who is neurodiverse. Make sure when you make trainings or signs that they are also clear, and there's an example to follow. So I'm not going to read all of this, but this is a immediate first aid ordinance that I made up that is from a fictional safety committee um, trying to warn people of what to do if they get injured from sharp materials. And there's many steps, and it's in very small font in this little image I made to the right on this document that says safety notice, please review. Um, Instead of something like that, I would recommend something that is a little more simple. Um, it can say something different, but this is just an example of something that may be more plain and make sure that somebody is doing the steps instead of possibly seeing so much text and not being able to read it in an emergency. Injury management should be first and foremost. A first aid kit should be nearby, having a sign showing where it is. Um, Next to a biohazard box should be an information packet with pictures and steps on what goes in the box and how to fill the box with waste. You may even have something like a QR code to a video. There should also be refresher trainings in person to ensure everyone knows what to do. So this is just a little blurb of text to, you know, add to this fictional scenario of ways to improve the setting. Um, there's another consideration for neurodiverse employees, which is proprioception, which is the awareness of one's body. Employees who are neurodiverse may have poor proprioception. So they do not perceive themselves well in the space they are in, especially if they are hyper focused. So they may work themselves too hard physically without even realizing, um, or they may need to take extra precaution when working with sharp objects. I know for a fact I always forget about my physical needs. So even though I have a bad back, sometimes I'll try lifting heavy objects in the office, and Todd always has to remind me, like, hey, you probably shouldn't be lifting that. Um, and another consideration of proprioception, if your employee is prone to touching their eyes, you may want to have them use safety glasses if they're working with biohazards. Time buffered schedules allow for processing and reflection for all neurotypes. So consider having breaks during long trainings or breaks in video trainings. Even all after all you can do to make a training good, you may take all the steps to have all the different types of resources and have it in person or virtually. Um, Everyone's memory capacity is about the same, and on average, it is estimated that 50% of what is learned is immediately forgotten. So, spaced learning helps retain what is taught. That's just how our brains work. So I have a slide here with a graph. On the axis that is going up, which is the y-axis, is retention of information. And on the x-axis is time, increasing as it goes along to the right of the graph. So when we start at this dot up at the top that says learn something at day 0, that learning curve sharply goes down as time goes on. And if there's no points of review, which are marked by these green lines, then the forgetting curve is very, very sharp, and it you are more likely, judging by this graph, to forget most of the things you learned. However, if you have more days of review, not only does your retention increase with each iteration of review, but this forgetting curve starts to flatten out. So each time you are reminded of the same information, you are less likely to forget it and you are more likely to retain more of the information. So, what we recommend is that you not only do annual reviews, but you may want to show the same information more often for retention. And also, there is evidence showing that information retention for all neurotypes is also affected by location. So employees are more likely to remember information in the spot they learned that information. So, for example, if you're doing a biohazards disposal training in a training room and not in the place where they'll be using that biohazards disposal box, that may not be the best place because that's not where they're going to be using it. If you are going over emergency procedures, especially, teach them in the place an emergency might happen. So how can you improve your safety training? We've created a checklist for you to discuss with your employees and apply to your trainings. So this document right here is considerations for trainings. Does your training meet the needs of all employees? Fill out this chart to determine if you meet the needs of your staff. It is best to fill this out with employees you wish to assist the most. So I called this training Safety Training Blood-borne Pathogens for today. And there's three columns. The first one on the most left is the type of consideration, and that's what's already filled out on the blank sheet that I have in the Google Drive. And then there's a current training, which you fill out, and any improvements to make column as well that you fill out. So for example, let's say you're trying to improve this safety training with blood-borne pathogens. Can employees freely ask questions during this training? So this fictional scenario, the manager is filling this out and says employees can ask their managers via email after the training. And any improvements to be made? They answer, we plan on making the training more interactive so employees can freely ask questions and that the trainer is respectful of all questions. Universal design. Are there multiple formats of the same training, in person versus virtual, handouts, recordings? The fictional manager puts in here, we have an online training that is given live every year. We also have an in-person training given upon hire. And after the presentation that they saw, um, they decide to make some improvements. They say, we will create some step-by-step documents and record the next virtual presentation to give employees the options to watch a recording. Um, so this row applies for potential emergencies. Are there one-on-one clear written emergency plans between employees and managers? And then the fictional manager says, yes, there are, and that no improvements are currently needed. So yeah, this exact document is in the Google Drive. Like I said, there's examples for each consideration to make, and we will be improving this document as we get more feedback. So I am going to get back to the slides and ask everyone after you have all seen this information, do you have anything specific from this training you wish to apply to your own trainings?
So we meet, I'm Stacy from the Arnold Center.
Yes,
Um,
hello.
we meet monthly, our safety committee does, and we always go over like bloodborne pathogen training and things like that. So this will be good information to take to them. It's our safety meeting is actually Thursday. So
Hmm.
I will be taking this information and going into the safety meeting with it so that we can start looking at how we can implement this into the safety and into our employees and things like that as far as trainings go.
Wonderful. I'm glad you really found some good information in here. I appreciate it.
And I do have a question. I clicked on the link that said for the handouts
Hmm.
and I cannot download them. It says every time I try
Oh,
to click on them, is there a reason? Am I not doing something right? Because I tried
Um,
to download them and it said that I can't.
Let me see. That might be my fault. I'll change the permissions and see if that helps.
Okay.
And it
Thank
might
you.
be no, no problem. Thank you for letting me know. I think yeah, anyone with the link is an editor, so it may be something on your end.
Okay.
Sorry about that.
That's okay. We'll figure it out.
What I planned on doing is sending people files after this
Oh,
too,
okay.
in case
Okay,
the
that'll
Google
be
Drive doesn't
helpful.
work. Yeah.
Thank you.
Happy to help. Alrighty. Well, I think that's a good time to move on. Thank you for being part of this presentation and watching what we had to share. I'm going to pass it over to Todd.
Yeah, thanks, Katie. Great job. Uh, Delighted to hear that some of the concepts here may be applied in your organization. So our goal today was to provide you with a chunk of information that was specific to compliance with the standard and another chunk of information that would allow you to filter some of that info through the lens of making it more inclusive, particularly to a neurodiverse audience. Um, if we can be of use in helping you refine the trainings that you offer to your staff, or even if you'd like us to provide a training, that's part of the purpose for this project. So if you'd like us to do that on your behalf or support you in your goals for reviewing the training content for a neurodiverse audience, just let us know, reach out to Katie. And if it's specific to a training, give us a little bit of info on date and time, the topic that you'd like us to cover, and about how many folks would be involved. But our preliminary approach, again, is to give you compliance information, Katie's great perspective on rendering the content more inclusive. And I hope it's useful to you. Does anybody have any questions before we close? We do have a list of the resources that we've cited as well. If you want to scroll through some of those, Katie, a lot of it has to do with either um, MyOSHA or CDC resources that you see there for the um, health and safety component. And then there is a plethora of resources on delivering content in a manner that's more inclusive of a neurodiverse audience, and a ton of resources there. So again, if you have any questions, we'll hang around as long as you like. If you have questions you prefer to ask offline, just email Katie. Her email was in the slide a couple of steps back. And thank you again for making time to be with us today.